So what do you do for TMJ?
Well, TMJ, what are the symptoms? So the patient has a sore joint, clicking, popping. They don't feel comfortable. They have a lot of pain with the muscles associated here, on one side or on both sides. And there are many reasons. There are many causes. Sometimes it can be caused by an accident. In many cases,
something that moves the jaw.
Yeah, so they can get into a car accident or a fall or something like that, and we want to try to determine what it is, that may have been the root cause of it. In some of those cases, they need to get a CT scan done to find out what trauma was done to the joint and evaluate what needs to be done. Well, it's important to find out, all right, rather than just let the problem go. In some cases, the patients have ground their teeth down and they're actually causing their joint to slide out, and then as the joint slides out, they ground their teeth down more, and that it's a process that perpetuates itself.
So you said, if you have short teeth, you have a TMJ problem. If they're getting shorter and shorter.
If you have short ground down teeth, you have a problem with the joint.
Interesting.
All right, and you might not even be in pain, but what you're actually doing is you're altering that joint. So at some point you started grinding your teeth, and then that grinding has contributed, as your teeth have worn down, now the joint has to move to compensate for it. And as it moves to compensate and you keep grinding your teeth more, the joint is sliding out of position. So there is a way to take care of that, and you have to find out what the problem is, and you have to do something about it, because
so
it's
you
not
fix it there. You correct it in your practice.
Yes, we correct it in our practice, and sometimes with some patients it's as simple as just a little appliance called a night guard. And it can, one patient I remember, she would come to me just in tears and in pain, and I talked to her about the options, and I said, at the very least, why don't you get a night guard made? And she came back to me 3 different times, and she just didn't want to do anything. Finally, she said, all right, I'll get a night guard. And I didn't have any contact with her we made the night guard. I didn't have any contact with her for one reason or another for quite a long time. And when I did meet up with her again, I said, how you doing? She goes, I can't believe what the night guard, just a night guard, did for me. It changed everything. Now that
out of pain. She's out of pain.
She's out of pain. And that might have not been what she ultimately needed, but if she's out of pain, that means the swelling has gone down and she's feeling better. At least she's better. So
come in, get evaluated.
Come in and get evaluated. If you have a problem, don't think the problem is going to solve itself, because all it's going to do is the problem is going to expand, the problem is going to get worse if you don't intervene. All right, and that's what we're there to do.
Okay, good.
To make you healthier,
Okay,
smile
good.
better.